well-being, stay healthy. Health and well-being are tonics for a happy and stable life. Well-being on AD4 TV Radio brings you lucid insights and hands-on engagement of issues towards your positive well-being. Watch Well-being on AD4 TV Radio. Well-being, stay healthy.
Hi there, this is Well-being on AD4 TV Radio. I am Eugenia Yuheme, and I'm glad you could join us. It is normal to have some level of anxiety. You may feel anxious or nervous if you have to tackle a problem at work, go to a job interview, take a test, or make an important decision. Anxiety is sometimes just a natural reaction. It can even be beneficial, such as when it helps us to notice danger, so we focus on being safe. However, anxiety goes beyond the ordinary. It tends towards nervousness and even unnecessary fright. It becomes a disorder. And so on Well-being today, we will be taking a more curious look at anxiety disorder. Joining us today is Mr. Patrick. You're welcome, sir. I'm so happy to have you in the studio today. Okay, so let us get right at it. So now, what is anxiety disorder? And then how common is it?
Well, the global statistics put anxiety disorders at a percentage of about 1 in every 100 people.
Okay.
And it's actually a little bit, it's a little common because, as you just rightly said, anxiety is a natural process. You know, it's when the early men started walking the earth, they had to develop flight and fight responses to situations.
Yeah.
And this flight and fight responses is what has evolved into what we now interpret as anxiety responses. You know, so it's a very fairly common issue, and it's grouped under the spectrum. When it becomes an anxiety disorder, then it's grouped under the spectrum of mental illnesses.
Okay.
And which can range from things like depression to anxiety disorders.
Yeah.
We also have what we call anxiety neurosis, which is a more advanced form of anxiety disorder. And then you now have things like schizophrenia, then you have things like the full-blown issues of mental problems that you have. So,
Yeah.
it is something that is fairly common, and if most of the time, if it's not diagnosed early enough, it can cause a lot of damage before one now recognizes that anxiety is actually a serious problem.
Yes.
A serious problem. You know, so as for statistics, and also it affects both sexes, both male and female, and also you can see it in children.
Okay.
So all this depends on the triggering factor. You know, anxiety disorders usually have trigger factors.
Yeah.
You know, but I'm sure you'll ask me all that as we go along.
Okay. All right. Okay, so now I know anxiety disorder is a compound term.
Yeah.
Okay. So now what are the types of anxiety disorder? Because I know it starts from somewhere before it gets to another level.
All right. So before I go into the types of anxiety, it's good to really understand what anxiety is.
Okay.
You know, as I said, it's part of a flight or fight response.
Yes.
But the only difference is that when a person has an anxiety disorder or anxiety neurosis, the person is having an exaggerated response to a normal event.
Okay.
You know, so for instance, let's take both of us now, we're going on air. There is a little anxiety that we should have.
Exactly.
That going on air, knowing that there are millions of people watching and we could make mistakes and all that. But in some individuals, the fear becomes so exaggerated that they may not even be able to complete the thought. And then you're wondering, okay, is it, what's happening?
They're really jittery.
Yeah, this, you know, with anxiety is beyond jitteriness. It's
Okay.
more to the point of actual fear. But it's fear that is unsubstantiated. Do you understand? Because you cannot see why that person is having such an exaggerated response to something that everybody is doing. So there's so many reasons for that. Now, for the types of anxiety, within anxiety itself, anxiety disorders itself, there's so many spectrums. You have the generalized type of anxiety. You have the phobias. And the phobias are of different categories. You have fear of heights, you have fear of water, you have agoraphobia, you have photophobia.
Yeah.
There are all those types of phobias.
Exactly.
You know, so within those components of those phobias, fear of snakes, you know, phobia for heights and all that. Within those types of phobias is some form of anxiety.
Yeah.
Because it is an exaggerated response to something that people should not be normally afraid of. You know, so you have the generalized types, you have the phobias, you even have medication-induced anxiety. You have separation-induced anxiety.
Wow.
Yes. You know, and then other spectrums of anxiety that are within the component of even post-traumatic stress disorders are some form of, you know, anxiety. But these are the major components of anxiety that we usually we see commonly.
Okay.
And then within those spectrums, you have subsets. You know,
Wow. It's actually very...
yeah, it's quite a very large,
Yes.
you know, component to deal with. So that's why sometimes diagnosing it can be a little tricky. You know, because as a medical practitioner, it may be difficult for someone to spot the exact type of anxiety the person is having.
Yes.
You know, and sometimes it's only when you're able to do that that you're able to now profile solutions to
To
the
it.
problem the person
Yes.
is having. You know.
Wow. Okay. So, okay. Is it, will you call it a mental health condition?
Yes, it is a spectrum. As a medical practitioner, I'll tell you that anxiety disorders are mental health problems.
Wow.
Yes,
Okay.
they fall within the category of mental health problems because when you sit with someone that has anxiety neurosis, the person doesn't have any physical issues. If you run laboratory tests, you will not find anything that will point towards the fact that will explain the symptoms this person is having. So the symptoms this person is having is basically in the mind. You understand? And sometimes the anxiety disorder itself is a symptom of a larger component of issues happening underneath that you need to unravel.
Yes.
And that is why most of the time you send them for shrink sessions, you send them for to see a psychiatrist,
Yes.
to see a counselor, depending on the kind of issue the person is having.
Okay.
Yeah.
Okay, now, so what are the causes of anxiety disorder?
Right. So thank you very much. There's so many causes of anxiety disorders,
Wow.
you know, because there's so many types of anxiety disorders anyway. And most of the time, these causes may be born in the biological system or in the person's social and developmental processes.
Yes.
So what I mean by biological is that somebody can actually have brain disorders that can predispose the person to having anxiety disorders.
Okay.
You know, because what happens is that the brain regulates the normal functioning of the individual and is responsible for cognitive development and also maintaining the normal character on a day-to-day basis.
Yeah.
So what do I mean by normal character? So for instance, if some people are stressed, you see them having a particular habitus. It could be things like tapping, or touching something,
Yeah, scratching.
or scratching,
Yeah.
you know. So, but when people have anxiety neurosis, they do those things to an extreme. Do you understand? And sometimes if someone has a brain injury or has some form of brain disorder or has an inherited defect in the neurons of the brain, the person can develop those anxieties without any physical alteration.
Yes.
So to say. So we see that sometimes, even though it's rare.
Okay.
Then you have other causes that have to do with trauma. Sometimes trauma in childhood. Sometimes past traumatic events. Let me give you an example. Some people can be afraid of snakes because they've been bitten by snakes.
Yes.
So whenever they see a snake, there is an exaggerated response. Even though the snake is far,
Yes.
they feel that the snake is going to, they may even faint.
Because they've had an experience.
Yeah, because they've had a very bad experience, and that experience is in their memory. And when they see a similar event, it triggers the
Yes.
responses.
Need to remember.
Yes, and those responses, okay, I didn't even get into that, are usually always common across all anxiety disorders.
Okay.
You know, so regardless of the cause, when a person has anxiety disorders, there are a spectrum of things you start seeing: restlessness, difficulty in breathing,
Yeah.
issues like excessive urination, being uncomfortable. Sometimes you see people even complaining of excessive eating, so they start doing things to excesses, and that creates sometimes, because it's a confused picture, whoever it is that is interacting with the individual becomes a bit confused. As to why is this person having all these problems? I once had a friend that had a similar problem, and his was of exams. So he was a very bright chap, even brighter than most of us. But once it's time for the exam, he will urinate 20 times. He'll be writing, you see tremors, he'll be shaking.
Yes.
But he's, and then you'll be wondering, is this not this guy that is even as, So sometimes all those things happen because something has happened to them mentally, and then they now are acting out in that fashion. So I talked about past occurrences. So someone being bitten by a snake, having a bad, falling from a height, can trigger some form of anxiety. Then, for instance, someone who has had a bad experience with falling from a height will enter a plane and have anxiety.
So much, yes.
He's not going to fall from that plane, but
just scared.
Just the fear of being in an elevated position that creates the same scenario that he had. So he has scars from that injury. Then the scars are now affecting his present life, even though the situations are not in any way gonna lead to
something like that
outcome that he's afraid of.
Yes.
So then you have that happening in the past, then also during development when children are growing too. So a lot of things. Sometimes broken family issues can lead to if the father is violent, the children can pick violence towards the mother. They can inherit that as scars. Do you understand? And then it's also one of those things that in the advanced societies creates serial killers. But that is another exaggeration. Response, you understand? So when people have those kind of bad experiences growing up, it creates all these issues for them.
Okay.
Then also you have conflict. So people who have been through conflict situations, who have been through kidnapping, develop a spectrum of disorders, from anxiety disorders to post-traumatic stress disorders. All kinds of issues, mental issues can arise as a result of that process that they went through. So you can have conflict. Then sometimes even excessive alcohol abuse, can lead to some form of anxiety neurosis. Sometimes people who take performance enhancement medications, can also wear down the normal process. So the body is no more self-regulating, and the person's regulation is not dependent on those medications.
Okay.
So people who are taking a lot of drugs, abusing drugs, you now find out that over time, if they're not on those medications, they start having exaggerated.
Yes, it becomes a problem.
And all that.
Okay.
As I said, it's a spectrum. Very large spectrum.
Okay, you're watching Wellbeing on AD4 TV Radio. We will take a short break, and when we return, I'm here with Mr. Patrick. Don't go away.
This is Impact 360 on AD4 TV Radio. This is a no-hold-barred program that x-rays and dissects, engages and interrogates, brings perspectives and understanding to anything and everything that impacts our lives, the choices we make as individuals, businesses, and state actors. Impact 360 leaves nothing out, from policy to people, lifestyle to culture, business models to innovation, and from known to the uncharted frontiers. Nothing is out of the radar. Everything in the circle.
You're welcome back from the break. I'm still here with Mr. Patrick Eze. Okay, sir. So when we were talking, you mentioned generalized disorder, just generalized anxiety disorder. I don't know if you can throw more light on it. What does it mean?
Okay, so when we talk of the generalized form, it's actually the most typical of the anxiety disorder spectrum. And in the generalized form, you have all the symptomologies I have explained, which is the restlessness, the frequency, the irritation, Usually as a result of that exaggerated response to an offending agent. So it's that umbrella where you have the that explains what anxiety disorder is. It's the most typical form. Yeah. So usually people have generalized forms of it and present as, maybe in the hospitals you see them complaining of, oh doctor, when I enter into the hospital, for instance, my BP goes up. That's it's unfathomable, but
yes. Personally, when I go into the hospital, I feel sick.
Yeah.
I perceive a lot of drugs and I'm feeling sick already.
So it's actually just the umbrella form of all anxiety disorders.
Okay.
So you see it on that spectrum, and it's what you most commonly will see first. And then you have all the spectrum of frequency, irritability, restlessness, weakness, and all that associated with a particular offending agent, more or less.
Okay. Okay, this part now is a little bit touchy for me. What is it like in children? Anxiety disorder, what is it like in children?
So, anxiety disorders in children is actually a different cascade altogether, because children don't have the typical responses you see in adults. Most of the time they can't speak, they can't relate their experiences in the way adults, because they can't express themselves in the way adults would clearly express themselves. And so what you do is you look for the silent signs that they're giving off, So sometimes you can see a lot of mutism. So when you see a child that is not verbalizing or vocalizing, and let's say beyond the age of 2 or 3, this child has been talking for a while, and all of a sudden he chooses to be mute. The child is not doesn't react properly to stimulus as he used to. He's not playing around. He's not, most of the time he's cold. He's all to himself and all that. So that has given you an idea that this child is experiencing some form of anxiety. Then sometimes they express anxiety in their drawings. Yes, so you see them drawing things that you're wondering, where is this coming from? Do you understand? And also, when they're around their mates, you see them, instead of playing like other kids, they're retracted. So sometimes when you start seeing these behavioral changes, it gives you an idea that this child may be having some form of issues. Sometimes in more evolved children, you will see all those signs of tremors and fear that is unexplained. Do you understand? And then you will wonder, okay, why is this child having this? So that becomes a point of reference where you should now go and see a physician, and then explain some of the symptoms to him or a pediatrician. And then they will now clarify what the child is going through and explain if these are normal reactions to what is known.
Yes. Okay, so how is anxiety disorder diagnosed? Then who can diagnose it?
Yeah, so you have to come and see us in the hospital. So if you feel that you have an anxiety attack, usually people can self-diagnose anxiety attacks or anxiety disorders. When I use attacks, it's more cognizant with panic attacks, which is a form of anxiety disorder. Panic attack is a form of anxiety disorder. Yes, it is. So when you have people, that's even what we're trying to do today, at least let people know that when they start experiencing some of these symptoms and signs, that it's a medical problem. And they should seek out a physician. Because that's the first point of healing. If you don't know that what is wrong with you is a problem, then you may be stuck with the issue until it now leads to things like suicide and all that. So usually one can self-diagnose anxiety attack if you have enough information. Anxiety disorder, if you have enough information about it. So then the second part of it is when you go to the physician. So with the physician, he will listen to you. If you see your general physician, for instance, for a start, he will listen to you and be able to pinpoint what kind of anxiety you are dealing with. Is it a post-traumatic stress problem? Is it an anxiety that has a base in reality? because most of the time people will just complain and say, doctor, I don't know what's wrong with me. Or sometimes you see people complaining, we see them on a daily basis. Oh, doctor, I feel like something is crawling all over my body, and I can't sleep, and
don't know how I'm feeling.
Yes. So sometimes the complaint is very vivid, and they feel that it is tied to a pathology that is known. Do you understand? Or that is common.
Yes.
Without knowing that they're actually having anxiety problems. Okay, I'll give you an example. I recently had a patient that I was seeing almost 3 times every week for almost 6 months. So you treat her for this, she will go come back, doctor, I have this problem. She will go come back, and before then she was doing that with another physician. And then he got tired and was like, madam, you see, I have 200 people, I can't be seeing only you. And then when she came to me, she was referred because they were like, Dr. Patrick will listen to you. So just pour out everything. And she came with that kind of business, so she kept on pouring out and pouring out. So I thought, okay, so madam, what we'll do is anything you talk about, we'll follow it, and then we'll see, we'll run the test, and we were going that way. So at some point I found out that her problems were unending. Then it took me a while. Then at the end of a month, and now occurred to me, I said, this woman actually does have anxiety problems. It's not all those things she's complaining about. I feel that they're so real.
Yes.
So you know what I did? I didn't even tell her. I placed her on an anti-anxiety medication, and I never saw her again. So later I was not asking about her, and they were like, she was like, no, she's okay now, she's fine, and there's no problem and all that. You understand?
Okay.
So she didn't even know that as part of the medications she was taking, and an anti-anxiety medication was part of it, and as she was taking it, all those so-called problems vanished. So I'm even the one that even calls her and be like, have you run out of your medication? And she's like, no, doctor, I'm okay now. Do you understand?
Yeah.
So sometimes it presents as someone frequenting the hospital for complaints that, today is this one, tomorrow is that one, tomorrow is another one, So if the doctor has a high index of suspicion, he can pick it and say, okay, this woman, I think this is what you're dealing with, and then help her in that regard.
Okay, so you've talked about treating it a little bit, so I don't know, you can just throw a little more light on how to treat it.
Okay, so the first thing is when people have anxiety disorders, they need someone to talk to. And they need someone to believe that their symptoms are as real as they're experiencing it. So because we know it's a mental problem, you don't want to belittle the person, because when you belittle the person hides in his shell.
Yeah.
And continues to manage the problem any way he feels he can manage it. Sometimes you hear things like, oh, it's from the village and all that, and then they start seeking for alternative medications and going to all kinds of people for treatment, whereas this is something that is based in the field of medicine.
Yes.
It's just a mental disorder. So first of all, you want to ensure that the person either gets help by having someone that can listen to the person. You can start from a counselor.
Yes.
And from there grow into seeing a medical doctor or a physician. And then if the physician is not able to handle it, he can refer you to, say, a psychiatrist or a psychologist. Now, for treatment, there are so many things that can actually be used to manage anxiety disorders. The first one is there are medications for it. So these medications could be short-term, it could be long-term. But depending on the length of time and the severity of the anxiety disorder the individual is having, that determines the type of medications you want to use. So some people can have anxiety disorders that prevent them from sleeping. Do you understand? And if you just make them sleep, the problem can reduce or even go from there. Then sometimes some people are unnecessarily have that unnecessarily anxiousness in situations, and sometimes all they need is a calming drug. So we have a spectrum of medications we use for anxiety disorders. We call benzodiazepines, and any one of them can help to even relieve, because as I was telling you when I was explaining anxiety disorders, I was saying that most of them have the same symptoms, but maybe but different triggers. So when you see somebody who is afraid of heights, he will be having that restlessness, jitteriness, he will want to go to the toilet often to pee, he will have the tremors. That somebody who is afraid of writing an exam will have.
Yes.
So the symptoms are almost similar, and the only thing is that, so when you give those medications, they help with all those symptoms. And once the symptoms are not there, the person will feel a little better.
Okay.
So there are other things, like sometimes we recommend physical activity, exercise. What exercises do is they take your mind off those issues that are making you anxious.
Yes.
And then you, at the same time, build yourself. So if there are people who have become exercise buffs, or addicted to exercise, as a way of managing their own anxiety disorders without actually knowing that that's what was happening.
Yes.
So exercises are good for those who can partake in them.
Exactly.
Then reduction of things like caffeine and alcohol also to a large extent helps you, because anxiety disorders are based in the central nervous system and the brain. So, and all those drug compounds and medications affect the brain.
Yes.
So anything that affects the brain to a large extent worsens the situation. So you want to avoid that. Avoid illicit medications and drugs, because they sometimes worsen the anxiety attack. It may look like they're helping the anxiety disorders initially, but eventually it may lead you to a more difficult situation, put you in a difficult situation where you now become dependent. And that's a different problem on its own, So then, apart from that, we also advocate healthy relationships. So we know people who have anxiety disorders, and just by meeting the right partner and all that, then stress level reduces, and then they're able to become better. So healthy relationship, not only spousal relationship, but even friendships, club arrangements, anything that healthy livelihood also can, to some extent, help to manage anxiety disorders.
Okay, thank you very much, Mr. Patrick. I'm educated. I'm really happy for this information today.
It's my pleasure.
I'm really happy to have you today. Thank you very much, Mr. Patrick Eze, for sharing your knowledge with us. So if you are experiencing an anxiety attack of any form, head straight to the nearest certified healthcare facility. Thank you very much for joining us. It's Wellbeing on 84 TV Radio. I am Eugenia Yuheme. Bye for now.